One surprising place your body may reveal clues is your fingernails. Changes in nail color, texture, or growth can sometimes reflect changes happening in your blood, which may be linked to declining kidney function. Pale nail beds, unusual white bands, deep grooves, or nails that become unusually brittle could all be signs worth paying attention to. While these changes do not confirm kidney disease, they can be a reason to speak with your doctor and have a simple blood and urine test. The good news is that kidney disease is much easier to manage when it is found early. Paying attention to small changes in your body and getting regular health checkups can help protect your kidneys and your overall health. Sometimes the smallest signs are the ones that matter the most. One of the earliest warning signs many people miss is persistent foamy urine. If the bubbles stay even after flushing, it could mean protein is leaking into the urine, something that can happen when the kidneys are damaged. If you also notice unusual white bands on your nails that disappear when you press on them and return as soon as you let go, it's a good reason to schedule a medical checkup. Another surprising clue is nails that look unusually shiny or polished even though you haven't used any nail products. This can happen because kidney disease may cause waste products to build up in the blood, leading to intense itching, especially at night. Over time, constant scratching smooths and polishes the nail surface without you even realizing it. If you've had months of unexplained itching with no visible rash, don't ignore it. Take a look at the pale half-moon shape near the base of your thumbnail. If it was once visible but has gradually disappeared, it may be another sign that your body isn't producing healthy nail tissue as it should. On its own, this isn't proof of kidney disease, but together with other symptoms, it's worth discussing with your doctor. Some people also develop spoon-shaped nails that curve inward enough to hold a drop of water. This is often linked to iron deficiency, which is common in people with chronic kidney disease. Finding low iron is important, but discovering the reason behind it is even more important. Finally, watch for tiny, dark red or brown streaks under your nails that resemble small splinters. These are caused by tiny broken blood vessels. While they often result from minor injuries, if they appear on several nails without any obvious cause, especially along with fever or feeling unwell, seek medical attention promptly. Your nails may seem like a small detail, but sometimes they provide valuable clues about what's happening inside your body long before you notice other symptoms. Not every dark mark under a nail points to kidney disease. If you suddenly notice thin red or brown streaks across several nails, along with a fever, night sweats, or feeling seriously unwell, seek medical care immediately. That combination can be linked to a dangerous heart infection, not a kidney problem. Another warning sign to never ignore is a single dark brown or black stripe running the length of one nail that keeps getting wider or spreads into the surrounding skin. While it may look like an old bruise, it could actually be melanoma and should be examined by a dermatologist as soon as possible. The strongest nail change associated with kidney disease is called half and half nails. The lower half of the nail near the cuticle becomes dull white, while the upper half turns reddish-brown, separated by a sharp horizontal line. Unlike a stain or injury, this pattern doesn't grow out because the change happens in the nail bed beneath the nail. The white section is linked to fluid buildup, while the darker section is thought to result from waste products affecting pigment in the nail bed. Studies have found this pattern in up to 40% of people with chronic kidney disease, but it is uncommon in those without it. If you notice this change, don't panic, but don't ignore it either. It's a good reason to schedule a medical evaluation. These nail changes are only clues, not a diagnosis. The best way to know how healthy your kidneys are is to ask for two simple tests. The first is the eGFR, a blood test that estimates how well your kidneys are filtering waste. The second is the UACR, a urine test that checks whether protein is leaking into your urine. Your eGFR tells you how much kidney function remains, while the UACR can detect kidney damage even before the blood test becomes abnormal. Together, they provide a much clearer picture of your kidney health. There are also simple ways to protect your kidneys. Keep your blood pressure and blood sugar under control, as they are the leading causes of kidney damage. If you regularly take pain relievers like ibuprofen or naproxen, especially if you're over 55 or have high blood pressure, talk with your doctor about whether they're still the safest option. Long term use can reduce blood flow to the kidneys and increase the risk of damage. Let's quickly review the 9 signs: pale nail beds, brittle or ridged nails, Bose lines, Murky's lines, unusually shiny nails, a disappearing half moon, spoon shaped nails, splinter hemorrhages, and finally, half and half nails. One sign by itself may not mean much, but when two or three appear together, they create a pattern that's worth investigating. Kidney disease rarely causes pain in its early stages, which is why so many people don't realize they have it until it's advanced. Your fingernails won't diagnose kidney disease, but they may be the clue that encourages you to get tested. Take a close look at your hands under good lighting tonight. It only takes a couple of minutes, and those small details could help you catch a problem before it becomes much more serious.